The nervous system consists of a voluntary somatic component and an involuntary autonomic component, with the latter further divided into the sympathetic and parasympathetic systems. Parasympathetic efferents originate from cranial nerve nuclei 3, 7, 9, and 10, as well as sacral segments S2 to S4, using acetylcholine as the primary neurotransmitter. Acetylcholine is synthesized in nerve terminals by choline acetyltransferase from acetyl-CoA and choline, transported into vesicles by the vesicle-associated transporter, released into the synapse by snare proteins, and broken down by acetylcholine esterase. Key drugs targeting these mechanisms include hemicolinium to inhibit choline transport, vesamicol to inhibit vesicle transport, botulinum toxin to inhibit snare-mediated release, and acetylcholinesterase inhibitors to block the breakdown of acetylcholine. In contrast, sympathetic efferents originate from thoracic segments T1 to T12 and lumbar segments L1 to L5, primarily relying on norepinephrine, with the exception of sympathetic fibers to sweat glands and skeletal muscle vasodilator fibers, which release acetylcholine. Norepinephrine synthesis begins when tyrosine is hydroxylated to DOPA by tyrosine hydroxylase, decarboxylated to dopamine, and then hydroxylated to norepinephrine before being stored in vesicles by the vesicular monoamine transporter, released by snare-like proteins and inactivated by monoamine oxidase. This pathway can be targeted by metyrosine to inhibit tyrosine hydroxylase, reserpine to inhibit vesicular transport, or monoamine oxidase inhibitors to elevate norepinephrine and dopamine levels. Both systems exert their actions through specific receptors. Cholinergic receptors include M1, M2, and M3 muscarinic receptors, coupled to GQ, GI, and GQ protein respectively, along with ligand-gated nicotinic NN and NM receptors, while adrenergic receptors include GQ-coupled alpha-1, GI-coupled alpha-2, and GS-coupled beta-1, beta-2, and beta-3 receptors, alongside GS-coupled D1 dopamine receptors. Parasympathetomimetic drugs mimic the cholinergic system. They consist of two major groups based on their mode of action: direct acting and indirect acting. Direct acting drugs bind directly to muscarinic or nicotinic receptors, whereas indirect acting drugs inhibit the enzyme acetylcholinesterase. Direct acting muscarinic drugs are further classified based on the structure into esters, for example, acetylcholine, methacholine, carbachol, and bithanicol, and alkaloids, which include pilocarpine or nicotine. Indirect acting drugs are further classified based on the duration of action into short acting like edrophonium, intermediate acting like neostigmine, pyridostigmine, and physostigmine, and long acting like parathion and malathion. They affect a wide range of organ systems. In the CNS, small doses can cause mood elevation and alertness, while large doses can cause seizures and coma. In the eyes, they cause miosis. In the heart, they decrease contractility, heart rate, and conduction velocity. In the lungs, they cause bronchoconstriction. In the GIT, they increase peristalsis and decrease the sphincter tone. In the urinary bladder, they cause contraction of the detrusor muscle and relaxation of the trigone and sphincters. In glands, they increase secretions. Cholinomimetic drugs have a wide range of clinical applications. Pilocarpine is used in Sjogren's syndrome to increase salivation and in glaucoma to decrease intraocular pressure. Nicotine is used as a gum or patch for smoking cessation. Vanicillin is another drug used for smoking cessation. Succinylcholine is used as a muscle relaxant in anesthesia. Idrophonium can be used to reverse non-depolarizing muscle relaxants, but neostigmine is the preferred drug for this. Pyridostigmine is used for the treatment of myasthenia gravis. Physostigmine is used for the reversal of severe atropine poisoning. Rivastigmine, galantamine, and donepezol are cholinesterase inhibitors which are used for treating Alzheimer's disease. The toxic spectrum of these drugs can be remembered using the mnemonic dumbbells: D for diarrhea, U for urination, M for meiosis, B for bradycardia and bronchoconstriction, E for excitation of CNS and skeletal muscles, L for lacrimation, and S for salivation and sweating. We move to parasympathetic antagonist. These drugs can be classified into antimuscarinic, antinicotinic, and cholinesterase regenerators. Muscarinic antagonists can be M1 selective, for example, perazepine, M3 selective, for example, darifenacin, or non-selective like atropine or tropicamide. These drugs act by competitive inhibition of muscarinic receptors. Nicotinic antagonists include ganglion blockers such as trimethophan and hexamethonium. Acetylcholinesterase regenerators include pralidoxime. Blockade of receptors in the central nervous system causes sedation and acts against motion sickness. In the eyes, this causes mydriasis and cycloplegia. In the bronchi, this causes bronchodilation. In the GIT, it causes slowed peristalsis and reduced salivation. In the urinary bladder, it causes relaxation and urinary retention. In the heart, it causes tachycardia. In the glands, it causes a reduction in lacrimation and salivation and sweating, as well as a decrease in gastric secretions. Blockade of muscarinic receptors has no effect on blood vessels and skeletal muscles. The following antimuscarinic drugs are used clinically. Scopolamine is used for the treatment of motion sickness. Antimuscarinic drugs like atropine, hometropine, and tropicamide are used to cause mydriasis in the eye. Ipratropium and tiotropium are used by inhalation to promote bronchodilation in asthma and COPD. Perazepine is an M1 blocker used to treat peptic ulcers. Darifenacin and solifenacin are M3 receptor blockers used for the treatment of stress incontinence. Toxic doses of these drugs can cause fever, drying of secretions, moderate tachycardia, sedation, amnesia, delirium, and dilation of cutaneous vessels in the arms, head, and neck. This can be remembered by the mnemonic hot as a hare, dry as a bone, mad as a hatter, and red as a beet. In the elderly, these drugs can also precipitate acute angle closure glaucoma and urinary retention. Nicotinic antagonists like trimethophan and hexamethonium were used to treat hypertension but have become obsolete due to their poor side effect profile. Pralidoxime is a cholinesterase regenerator that has a high affinity for the phosphorus atom in organophosphates. The affinity for pralidoxime for the phosphorus atom of organophosphates exceeds the affinity of acetylcholinesterase for this phosphorus. This active enzyme is then degenerated. Therefore, pralidoxime is used to treat patients exposed to high doses of organophosphates. Now, we will talk about drugs that mimic the sympathetic system. These drugs can be classified into direct acting and indirect acting. Direct acting are further classified into non-selective catecholamines like epinephrine, norepinephrine, dopamine. Alpha-1 selective like phenylephrine. Alpha-2 selective like brimonidine, epraclonidine, clonidine. Beta non-selective like isoproterenol. Beta-1 selective like dobutamine. Beta-2 selective like salbutamol, salmeterol, formoterol, and ritodrine. Indirect acting are classified into releasers like amphetamine and methylphenidate and reuptake inhibitors like cocaine. The effects of activation of sympathetic receptors are as follows. Alpha-1 activation leads to contraction of vascular smooth muscles, contraction of the pupillary dilator muscle, leading to mydriasis, contraction of the bladder trigone and prostatic smooth muscle, leading to urinary retention, and stimulation of glycolysis in the liver. Activation of alpha-2 receptors leads to inhibition of adrenergic and cholinergic nerve terminals in the brain, stimulation of platelet aggregation, and inhibition of lipolysis and insulin release. Activation of beta-1 receptors leads to increased heart rate and force of contraction, as well as release of renin from the juxtaglomerular apparatus in the kidneys. Activation of beta-2 receptors leads to relaxation of smooth muscles in the airways, uterus, and blood vessels, stimulation of glycogenolysis in the liver, and stimulation of insulin release from pancreatic beta cells. Beta 3 receptor activation leads to stimulation of lipolysis in adipose tissue. D1 dopamine receptor activation leads to dilation of renal and splanchnic blood vessels. Now, we will discuss the clinical uses of these drugs. Epinephrine is the drug of choice for the treatment of anaphylactic shock. Amphetamines are widely used and abused for their CNS effects. However, an analog of these drugs called methylphenidate is used for the treatment of ADHD. Phenylephrine is used topically for nasal and ocular decongestion. Alpha-2 agonists like brimonidine and apraclonidine are used topically for the treatment of glaucoma. Beta-2 selective agonists like salbutamol are the drug of choice for the treatment of acute asthmatic bronchoconstriction. Longer-acting versions like salmeterol or formoterol are used for the prophylaxis of COPD and asthma. Norepinephrine is the drug of choice for septic shock. Dobutamine and dopamine are used to treat cardiogenic shock. Ephedrine and phenylephrine are used for the temporary management of low blood pressure during anesthesia. Isoproterenol is used for AV block management. Ditodrin is a beta-2 agonist that causes uterine smooth muscle relaxation and is used to treat premature labor during pregnancy. Toxic effects of these drugs include hypertension, cardiac arrhythmias, myocardial infarction, palpitations, insomnia, anxiety, restlessness, and risk of addiction or abuse, with indirect acting CNS stimulants like amphetamines. The final group of drugs is sympathetic blockers. These can be divided into alpha and beta blockers, which can be further divided into selective and non-selective agents. Non-selective alpha blockers include phenoxybenzamine, which is irreversible and long-acting, and phentolamine, which is reversible and short-acting. Examples of alpha-1 selective blockers include prazosin, doxazosine, and tamsulosin, and alpha-2 selective blockers include yohimbine. Beta blockers can be classified into non-selective first generation like propranolol and pindolol. Beta-1 selective second generation like atenolol, metoprolol, acebutolol, and non-selective with alpha-1 blocking action third generation like carvedilol and labetalol. The sympathetic blockers affect multiple organ systems by inhibiting adrenergic signaling. In the cardiovascular system, alpha-1 or beta-1 blockade lowers the blood pressure, while beta-1 blockade specifically decreases heart rate and cardiac output, though alpha-1 blockade frequently triggers reflex tachycardia. In the urinary system, alpha-1 blockade relaxes the smooth muscles in the bladder, neck, and prostate to ease urine flow. In the respiratory system, beta-2 blockade can cause bronchoconstriction as a dangerous side effect. And in the ophthalmic system, beta blockade decreases the production of aqueous humor. Non-selective alpha blockers are used in the pre-surgical management of pheochromocytoma, which is a catecholamine secreting tumor. Phenoxybenzamine is used during the preparatory phase and phentolamine is used during the surgery. Selective alpha-1 blockers like prazosin and doxazosine are used for managing hypertension. Tamsulosin and silodosin are used to reduce urinary hesitancy and prevent urinary retention. The clinical applications of beta blockers include hypertension, angina, arrhythmias, thyrotoxicosis, tremors, stage fright, and migraines. The toxicity of sympathetic blockers depends on their receptor selectivity. Alpha blockers commonly cause orthostatic hypertension, including first dose syncope, along with reflex tachycardia, dizziness, and nasal congestion. Whereas beta blockers can lead to severe bradycardia, AV block, worsening of acute heart failure, bronchospasm in asthmatic patients, cold extremities, fatigue, depression, erectile dysfunction, and the masking of hypoglycemic warning signs like tachycardia in diabetic patients. This is all about ANS drugs. If you liked the video, subscribe to my channel and I will see you in the next one.